Gastritis, the silent inflammation that could destroy your stomach. Gastritis is a condition that often starts subtly but can become a nightmare for your digestive system if left untreated. Understanding how this stomach inflammation occurs and the risks it poses to your health is crucial to avoid severe complications. But what exactly is gastritis? How can you identify its symptoms and treat it properly? Let's dive into the details and understand what happens in your body when it faces this enemy. What is gastritis? Gastritis is characterized by inflammation, irritation, or erosion of the stomach lining. This lining is responsible for protecting the stomach from gastric acids, which are essential for digestion. When this protective layer is compromised, acid begins to directly attack the stomach tissue, causing pain and discomfort. Gastritis can be acute, appearing suddenly and lasting for a short time, or chronic, which develops gradually and can persist for months or even years. What causes gastritis? Several factors can lead to the development of gastritis. The main causes include 1. Helicobacter pylori infection. This is one of the most common causes of gastritis. The H. pylori bacteria infects the stomach lining and, over time, causes inflammation. 2. Prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, medications like ibuprofen, aspirin, and others can damage the stomach lining, especially when used excessively or without medical supervision. 3. Excessive alcohol consumption. Alcohol irritates and weakens the stomach lining, making it more susceptible to inflammation. 4. Physical and emotional stress. Extreme stress can cause changes in the stomach that facilitate gastritis, especially in cases of severe illness or physical trauma. 5. Autoimmune diseases. Some people develop gastritis when the immune system mistakenly attacks the cells in the stomach, a condition called autoimmune gastritis. What are the symptoms of gastritis? The symptoms of gastritis can range from mild to severe, and some people may not experience any symptoms at all, especially with chronic gastritis. However, the most common signs include pain or burning in the upper abdomen, especially after eating, nausea and vomiting, abdominal bloating, loss of appetite, dark stools, indicating possible bleeding in the stomach, frequent indigestion. The dangers of ignoring gastritis. If left untreated, gastritis can lead to more severe conditions, such as 1. Peptic ulcer. Chronic inflammation can result in open sores in the stomach lining, known as ulcers, which can cause intense pain and, in severe cases, internal bleeding. 2. Gastrointestinal bleeding. In advanced cases of erosive gastritis, the stomach lining can bleed, which can be a medical emergency. 3. Anemia. Chronic blood loss due to gastritis can lead to iron deficiency and, consequently, anemia. 4. Stomach cancer. Chronic gastritis, especially caused by H. pylori infection, can increase the risk of developing stomach cancer over time. How is gastritis diagnosed? There are various tests that doctors can order to confirm a diagnosis of gastritis, including 1. Upper endoscopy. A thin, flexible tube with a camera on the end is inserted through the throat into the stomach, allowing the doctor to examine the stomach lining directly. If necessary, tissue samples, biopsies, can be collected for analysis. 2. H. pylori infection test. This can be done through blood tests, stool samples, or a breath test to detect the presence of the bacteria in the stomach. 3. Imaging tests. X-rays and CT scans may also be used, especially if there is suspicion of more serious complications. Treatment and medications for gastritis. The treatment of gastritis depends on the underlying cause, but generally, the following methods are used. 1. Medications to reduce stomach acid. Proton pump inhibitors, such as omeprazole, esomeprazole, and H2 blockers, such as ranitidine, are commonly prescribed to reduce acid production in the stomach, allowing the lining to heal. 2. Antibiotics. If gastritis is caused by an H. pylori infection, a combination of antibiotics will be prescribed to eradicate the bacteria. 3. Antacids. These medications help neutralize stomach acid, providing quick relief from symptoms. 4. Lifestyle changes. Avoiding excessive alcohol consumption, quitting smoking, reducing NSAID use, and managing stress are essential measures to relieve and prevent gastritis. Conclusion: gastritis is a condition that should not be ignored. While its symptoms may seem mild at first, failing to treat it appropriately can lead to serious complications such as ulcers, bleeding, and even stomach cancer. If you suspect you're suffering from gastritis, seek medical advice immediately for a proper diagnosis and treatment. Taking care of your stomach today can prevent much bigger problems in the future.